you. Thanks for that talk. I'm just sitting here thinking about retirement funds and how I am probably benefiting from the profits of these corporations.
Yeah.
And probably most of us have retirement accounts. And so how to square all that?
Yeah. Good question, because it's very likely true. Although you might not have as much money invested in United now as you once did, because that company has done rather poorly on Wall Street lately. And a lot of the big institutional investors have dropped out of that. It's a good point. There's one organization in New York that represents more socially minded investors, and I've spoken to them, and they often will propose shareholder resolutions to get these companies to try to do something different or to behave more socially responsibly. But I think those of us who do, or those of you who do work for corporations, you have IRAs or 401ks. My objective is to make these companies toxic in terms of campaign contributions and investments. And anything you can do to try to persuade your employer or whoever is in charge of your retirement funds, tell them you would rather not invest in one of these companies. And right now, it's not a good investment, to be honest with you. United has lost more than half of its value in the last, since the beginning of this year.
Hi, I'm currently a college student, and I guess speaking about United Healthcare, something that I know drew a lot of attention in college circles and people I knew was the senseless assassination of United Healthcare CEO. But I was just wondering, with your unique perspective of both being in the industry and now speaking out against it, your perspective on that, and whether you think that people working in healthcare insurance had sort of seen that coming, or any of your ideas around that.
I didn't see that coming. I was shocked as much as I think the rest of us. But on reflection, and I guess I was a bit taken aback by the response on social media to Brian Thompson's murder. It was a senseless killing. It was awful, awful. No way to justify it whatsoever. But people, what it did was, I think, kind of uncork something. People have so many stories to tell, and a lot of them took to social media to tell their own stories. Some of them were awful posts on social media, and supportive of the guy who's the alleged murderer, who, by the way, has raised, people have voluntarily sent over $1 million to his defense fund. It says something about our healthcare system and how people feel about it. Even when I was in the industry, we knew that we were not liked by anybody. Well, politicians, yeah, we bought them, but anybody that we couldn't buy, people just didn't like us. We once did a survey of people to see what could we do to be held in higher regard, and they said pay our claims and get out of our lives. But they obviously are doing exactly the opposite, because to be more involved in our lives and to make it more difficult for us to get the care that they need is how they make money and reward their shareholders. So what do we do with this reaction? I've said, how can we channel that anger, that outrage? And I'd like for us all to think about that. And I think some of it could be, even in this room, some ways that we might be able to figure out how to constructively use that outrage. To know that it's there. I saw one of the signs out here that says 70% of Americans support Medicare for all. And I've seen those polls as well, too. What happens is, though, what happened in 2016 here. You get up against the spending of these big corporations who get people to fear change. All these campaigns against change that we support are fear-based, and they're damn successful. They know what they're doing, and they have so much of our money that they divert to these propaganda campaigns to keep things from happening that would in any way impair their earnings.
Thank you so much, Wendell. My question is, how do you envision the role of artificial intelligence and AI, how that will affect our healthcare system as we go on here? And is there a potential that that might help simplify any of the major large system changes we need to make to get to universal model?
I would say it's certainly a double-edged sword to a certain extent. I think there's likely to be some good, some simplifications that could be brought to our healthcare system. Already there's quite a bit of auto adjudication, has been for a long time, but I think AI can help. We just need to make sure that it is a reality. It is going to become more and more of a part of our lives and our healthcare system and everything else in this world. But know that insurance companies are also figuring out how to use it in nefarious ways. ProPublica had a story a year or so ago about how Cigna has used AI to reject thousands of claims in one fell swoop. So we've got to be on guard. Another thing about the Big Beautiful Bill Act is that it has a provision that would tie the hands of states to enact laws to restrict the use of AI or to try to manage the use of AI in some way. So there's a lot of bad stuff in that Big Beautiful Bill, but I think they're both promise and threat from AI.
Hi. Okay, I am really frustrated with a lot of the talking that goes on around, and I am looking for ways that we can use our people power to, like you said, get money out of politics. And I've heard a couple things that I haven't heard anywhere else. One of them is boycotts of some of the large corporations, like not buying stuff from Walmart for this week, or things like a strike like the labor unions use to see if we can actually get some of our power back. The other thing I've heard, I don't know if you're familiar with Dr. Paul Zietz. Okay, he is proposing, he came to Colorado a few days ago and I went to his talk, and what he's talking about citizens assemblies where you take like people and you randomly select them and you get them together and you make a change to the Constitution. One of the main ones he talked about was getting money out of politics. And I don't know which one of these would work, and these are peaceful things, okay? Otherwise, we need maybe a violent revolution. I don't know. But I'm just throwing it out there to see what your opinion is about, how do we actually, get the people, get us to have the power and control, actually make the changes that we want to have.
Yeah, very good questions. Boycotts, I don't know that there's much evidence that they have long-lasting consequences. Conceivably, but I don't know. I'm not someone who's an expert in that area, but I don't know of any companies that come to mind that have been harmed in a long-term way, or have changed their policies in any significant way, except in ways that we would prefer they not to. With Trump's election, I think some corporations have been kowtowing to him and fearful of retaliation from the Trump administration, and we've seen some of them scale back, if not get rid of their DEI programs, for example. I think there's more promise in organizing and getting people to try to understand the importance of a constitutional amendment or something that would undo Citizens United and address the money and power problem that we're talking about here. So that's what I would encourage more focus and attention on. There are organizations that are out there working on that. They don't get a lot of attention. Issue 1 is one that I am very familiar with. In fact, the co-author of Nation on the Take, Nick Penniman, is the executive director of Issue 1. You might check out that organization, see what they stand for. And there are other good government organizations that are worthy of support too. Some of them are state-based or have operations in the states. So that's what I would encourage. The other thought that your question inspired was that I'm hoping that we can bring people together from different parts of the political and ideological spectrum to have a good conversations and using language that doesn't drive people away. Let's not go in and say, we know the way, you don't know, you idiot. Work with people to bring them along to see your point of view and to get them to understand that they too have a stake in trying to fix the problems of our healthcare system. And it's not just for them, it's for our children and our grandchildren. We need to try to do this for the sake of those that we care about. I'm going to be possibly trying to pull together some town halls that would feature people who have different points of view, but to try to determine where is the common ground. How can we get people who are not in our camp to begin to be persuaded that we've got a problem and that we can work together, and that working together is really the way that we will ultimately achieve change.
What I hear you describing is what I've been talking about for a long time, is public deliberation, where people are, healthcare professionals, local citizens, city leaders, local politicians, are sitting in a room for almost 2 days, looking at different sectors of the healthcare industry and having to have what is called a reasonable exchange. I'm not talking about people sitting in a room and complaining about healthcare. We're talking about people having to have an exchange with each other that is reasonable, that they're listening to different points of view, which is what you're talking about. People come in with different ideas about healthcare and so on, right? But when they have to exchange their opinions and have somebody else respond to their opinions, and that could go on for quite some time, right? That kind of deliberation moves people to some other understanding of healthcare without the moderator or somebody else coming in and saying, this is what you need to do. Okay? It's bottom up, it's not top down. It's coming from people.
Yeah, I think that's a good idea. I agree with that. I've at times had this dream of trying to figure out how we can bring together some thoughtful people who have knowledge and understanding of our healthcare system, but would park their ideology and their and an understanding of who's paying making their paying them to do to earn their living, and to just take a sober look at our healthcare system and see how it's organized and how broken it is for everyone except the ones who run the big companies, the ones who invest in them, and to seriously consider what other countries have done to organize their healthcare systems. I'd love for Tom Reed to be one of the guys in that room to help us figure out how to have a conversation. One of the things that I used to do in my old job was to get people to believe things that just simply were not true of other healthcare systems, particularly the Canadian system. There's very little understanding in this country of how a healthcare system in Germany, France, the Netherlands, Japan, wherever it is, the UK, Canada, there's very little understanding of how they really operate, how they are able to spend far less money than we do and have much better outcomes, and have achieved universal coverage. That's I think really this is the way out. We need to have those kinds of conversations and help people understand we do not have to have a system like this. We can have nice things. We do not have to spend twice as much per capita on health care and have these pitiful results. This is absurd. Why are we putting up with this?
Thank you, Wendell. Everything you're saying has been really helpful, particularly the getting money out of politics. As an insurance company insider, as our organization and the Alliance, mobilized to get an amendment on the ballot, say in 2028, for single-payer health care, is there any particular Achilles heel that we can go after in the insurance industry, in addition to what all the other things we've been saying, or Achilles heels plural, that we can go after within the insurance industry?
I do, and I think between now and whenever you do this the next time, help people understand these companies. Yes, we were talking earlier about this undercurrent of outrage that bubbled to the top and became visible after the murder. Through, as I said, how to channel that, but get people to more fully understand how they're being ripped off. Everybody has a story to tell, probably, of someone that they know who's been wronged in one way or another by big insurance companies. But you have to have a villain. You have to have people to understand how these companies really operate. And again, that's why Healthcare Uncovered exists, is to tell story after story, reason after reason why these companies should not be able to operate as they do. So I think the job between now and whenever this might go to voters, find those Achilles heels. Get people to inoculate the public. Tell them that what's coming down the pike is going to be even more than what came down the pike in 2016, with the insurance industry able to spend boatloads of money to scare the bejesus out of them. You've got to prepare for that. Learn from that experience and figure out, can you bring more allies into this work? How can you communicate in ways that are different and to try to overcome that? It's really, really hard. I don't want to discourage you, but I just want to say that you got to go into this with eyes wide open and know what you are going to be up against and how difficult it's going to be. You know that. You know it's going to be difficult. You could have an experience like you did in 2016 with polls showing great public support, and then in short order, that just dissipates.
Okay, good, it's on. A couple things. First of all, I want to really support people talking to each other. There are national organizations that are already doing this, such as Braver Angels, and one thing that Indivisible has is the Rural Caucus, and they're putting together community meetings. In fact, I'm setting one. I'm going to be doing one down in Fremont County. My other question is, though, I'm curious about what your feelings were about what Les Leopold was talking about with an independent party, and whether we should be pursuing that, and how that would work to just totally transform the Democrats as an alternative.
Yeah. And by the way, that was a great video. I appreciate that, and I wasn't surprised to see any of those charts, those numbers up there. I wish everybody could see that. And certainly the idea of having another party has a lot of merit, because, as I said earlier, as we know, a lot of Democrats are not our friends. They're not working on our behalf. They're working to get reelected, and they're taking cash from the bad guys. That's how our political system is. I would rather devote my time changing the system than trying to get a third-party candidacy going. We've tried that in the past. It's damn hard in this country. I'm not saying no. Don't want to throw a cold blanket on something I don't know all that much about or thought all that much about. But that's a heavy lift, to be honest with you, in this country. Just my own view.
I'm going to ask a question.
Yeah.
I'm pulling the microphone.
Okay.
So, we've got the transition, there used to be Walter Cronkite, and then there, and Barbara, his last name is, thank you, Walter. And then, there was the 3 network channels, 7, 9, and 4. And now we've seen really the proliferation of individual media. Your Substack was a wonderful example. And with Fox News, the majority of Americans actually watching Fox News and basically ingesting misinformation, consciously delivered. We're in this flux between centralized media, sort of, and decentralized. And in one way, that's an opportunity, power to the people. Anyone has a voice. I'm really curious how, and I'm sure you thought about this, and so have many people in this room, I'm sure, but how do we regain the truth? Communication's so subtle. Lucy said, "There's a QR code to Wendell's to free Substack. Here's a QR code to a free to Healthcare Uncovered free." And I thought, oh, it's a special QR code so that they can get it for free. But even though I subscribed, I didn't remember if I was paying for it. Anyways, it's like that's subtle, right? Is it free or is it free? Right? Special free or always free or whatever. This is not subtle. So how can we, in a completely open media environment, how can the truth prevail? How can actual journalism and facts? I just want to know.
Yeah, and I haven't given a lot of thought to this. In fact, the last chapter of Debbie Spin deals with this and is about the loss of what some call the iron core of journalism in this country and around the world. We saw it change radically, quickly. Scripps Howard, which I used to work for, I was in the Scripps Howard Bureau. It doesn't exist anymore. The Rocky Mountain News is long gone. As almost all of those, maybe the other papers are gone. There is no arbiter of news and decency like Walter Cronkite anymore. It's long past. One of the things that I saw a report on not long ago was, and I think it's a Scandinavian country, of efforts to try to help people understand spin, how to detect bullshit, to be quite frank. That's, I think, important work to do as well, too. How can we've lost a lot, I think, in our schools in terms of just people understanding civics, understanding how our government operates, or having critical thinking skills. I think a lot has been lost that has contributed to us being in the mess that we're in right now in this country and globally. When you have people who are so easily persuaded to believe things that are not true, who don't have critical thinking skills, who do not know what democracy is, who don't really fully understand how our country was founded and what it really means, it's easy to see where we are, how we got to where we are, how we can lose what we thought we had in place. The media environment, I'm grateful for Substack, is where my newsletter is, and I've been grateful that we've been able to grow it to a newsletter of some influence. There's a lot of people who have newsletters that have 4 or 5 subscribers probably and think they have influence, but so it's very decentralized, I guess. But also, one thing I wanted to mention is that, we've got Fox News. It's there. It's extraordinarily influential. It has led so many people to believe things that we know is not true. It's despicable that it is what it is. But on the other hand, it is what it is. And Pete Buttigieg and some folks are quite willing to go into that outfit and hold their own pretty well. We need to do more of that. We need to have more of our own people who are willing to go into those newsrooms and to, he's not necessarily someone who we can count on to get single-payer healthcare passed. But on the other hand, he is someone who's, in my view, has the courage and the willingness to do that. I think he's not all altruistic. I think he probably has ambitions, certainly beyond having served in the Biden cabinet and mayor of whatever it was he was mayor of. But he's a good politician. Let's encourage more folks to do that and to try to use even those outlets to try to get some truth out.
No, we're out of time.
Sorry, Steve. Lynn's the boss.
So you can probably catch up with you later, right?
Oh yeah, I'm around. I'm around.
Ask him directly. So we have our final stories now.
Okay. Thank you all very much. Thank you.